Welcome to another episode of Health Matters with PA Lynn Szabo.
Got it.
What are we going to talk about today, Lynn?
Hey, we're going to talk about a really exciting upcoming vaccination event in Del Norte and why it's important to get your kids vaccinated. And I wanted to reach out not so much as a healthcare provider, but as a mom, because I've had all the same concerns. I have two daughters. They were born in the early and mid 90s. And I had the same concerns about immunizations. I was hearing feedback in Humboldt County from my patients at the time, and they were asking questions that I really couldn't easily answer. And so what I decided to do was reach out to their physician. And initially, she just gave me all the standard handouts when I'm like, yeah, I kind of already know these. But then she made an offhand comment, and she reminded me, what she said is, you should probably protect them against what you're likely to be exposed to at work and probably bring home.
Yeah, that makes sense.
I know. And I was like, whoa, okay. So we'll move forward with this. So that advice really made sense to me. So, my kids currently are fully immunized, and they continue to have the recommended yearly vaccines. Both are healthy, functional adults, and they're doing well.
That's great. So you had mom concerns. Even as a provider, you're a mother first. So you had mom concerns.
I'm like, people are telling me this. What's the story about that? Is this for real? Is this, how am I supposed to answer this question for both my patients and my own kids? And one thing that really drove it home was my kids were in a small charter school in, like kindergarten and fourth grade. And influenza in Humboldt County that year started early. And then for some reason at this particular charter school, patient 0 showed up. And so my two kids got really sick with influenza. Their dad got sick. And I went through it without any illness, even though it's stressful taking care of, 3 sick people. And one of my kids asked me why I thought that happened. And I said, because I have my flu shot. I have to get a flu shot for work. And this is immunization working. And then every single year after that, both my girls get their flu shots.
Okay.
They're religious about it.
So mom didn't get sick because she immunized herself, but was worried about doing it for the baby.
Right, but did it by accident just because it's required for my work. And it makes sense when I take care of young babies and stuff. So the first question I had was, are vaccines safe for children? And I would say yes. And here's what spoke to me again as a mom. If you walk any older graveyard, and the one I happen to reference was in Ashland, and you see the heartbreaking number of children who die young, and in fact, you can also see like a whole family is taken out.
Oh, yeah.
Like days apart. That pretty much is an injury or an illness, not an injury. And, it doesn't really say on the tombstone, but I imagine something like influenza or diphtheria or pertussis or perhaps measles. And
wow.
In about the 50s and 60s, this all changed. You don't see that anymore in the graveyard.
Actually, you don't, do you?
You don't see whole families wiped out.
We don't. For Memorial Day, on occasion, I will go out and help put the flags up for veterans. But you walk the entire grave, so you don't miss any. And we have that whole section for just children. And you're correct. And there's some that multiple children die within the same time frame, a few months of each other. So that would make sense to have a flu or an illness that came through and.
Right.
Dang, that's just...
But as of the 50s and 60s, large-scale vaccination kind of started for most of the deadly childhood diseases. And you don't see that anymore, really.
You really don't.
And this convinced me more than any papers, more than any scientific jargon. But science was also mirroring this at the time. To me, what that says as a clinician is the risks of the diseases are way higher than the small risk of the vaccines.
Okay.
Yeah.
So you say there's a small risk. What is that small risk with vaccines?
Well, in my career, remember 40 years, most of the time after, the first 3 years that I was working in internal medicine, I've been working with young families with children, small children, and infants. And those risks that I have seen are the baby's fussy for a day. maybe they have a bit of a fever. Sometimes they get a rash. Sometimes at the injection site, it'll be kind of red and swollen and tender. Those are
Okay.
the side effects that I have seen in my career. I haven't seen anything worse.
And that's the only thing I've ever known
Yeah,
of.
right. And so I'm I think that if you're looking at the risk benefit ratio, if I step into my clinician mind, then really the risks of the immunizations are much smaller than the overwhelming benefit of having living children, which would be the point.
So the same thing for like an adult. My arm hurts for a day or two. It's kind of
Right,
wonky when I wash my hair, but it's
right,
better than being down for 2 to 3
right,
weeks with the flu and then getting pneumonia because of it.
right. So in my clinician world, I would say, mission accomplished. That's a good immune response. I'm happy that that happened to you. I'm sorry your arm hurts. Take some Tylenol.
So that's what that is an immune response.
That's an immune response.
Okay.
It's a positive thing. It's not an allergic reaction. It's not like anything that's going to be much more than a mild inconvenience.
Okay, that makes sense. Thank you for explaining that to me.
Yeah. And then the next question that moms have is, aren't vaccines, they're going to overload my child's immune system? Can they be given on an extended schedule? Well, I think most provider offices are good at that, but you have to consider the amount of stimulants to a child's immune system when you just put them down on the floor of your home to play with Legos. Even if you put a blanket down, remember in my home, a dog or a cat would be walking by. There'd
Right.
be
Your 3 other children.
friends coming in and out with street shoes on. Yeah.
So as clean as our homes are, they're gross.
There are a whole bunch of things that we don't want to think about that are in our houses. There are probably, I don't know, tens of thousands, maybe hundreds of thousands of things that could hypothetically stimulate the immune system, but it's designed to do that in young kids. So when a child is born, the immune system is kind of like a blank slate, and it's collecting information to build an immune response for the future.
Okay.
And so it doesn't see a couple of shots as an extra burden. It really
Okay.
doesn't. And so there isn't really any need to do an extended schedule. And that's actually kind of I think, a barrier to full immunization that moms are kind of putting in place.
So unintentionally thinking they're doing the right thing, they're kind of slowing down their child's body's ability to develop that immune response.
Right.
Okay.
Right. And so combo vaccines, which have come into favor lately, so that means a vaccine that has protection against maybe, like 3, 4, 5 different diseases in one shot. The reason those exist is because it's only one shot. So that's answering the concern a parent might have about, that's a lot of pokes.
Okay.
But that also means that you can't really separate them out into individual immunizations.
Okay.
So if you want fewer pokes, you kind of have to have more stuff in each poke. And then what happens a lot is a family will just want one poke, and then they'll want to come back in a week for a nurse visit. These never happen. They almost never happen.
What do you mean they want to come back in a week for a nurse visit? Like want their nurse
They
to
only
follow
want
up?
their child to get one needle stick.
Oh.
Okay, but maybe the child needs 3,
Okay. So
Okay.
then they don't show back up for the rest.
and they don't show back up. So that's a barrier to care. That's a
Yeah.
barrier to full immunization. Plus, that also means that every time this baby or toddler comes to the clinic, they know they're going to get stuck.
Oh, so you're teaching your kid that this is
Yeah, they catch on after
Okay.
a while. I think it's more emotionally traumatic for them than it is just getting it done. So the combo vaccines, that's not an overload on the immune system. And vaccine schedules are timed to occur when the infant is most receptive, when the immune system is most open to doing its job and starting to protect the individual organism from disease. But the other flip side of that, Nicole, is that a baby is also the most vulnerable to these kind of diseases. Even a breastfed baby is going to have a harder time, say, with RSV or influenza,
or whooping cough.
whooping cough.
Oh, that one's so sad.
Oh, that
to
was
see.
awful. As kind of an aside, In 2010, the old urgent care, which was in acute care across the street from Sutter, my colleague Kalani Baker diagnosed a case of whooping cough on a 4-month-old infant,
Oh my God.
and it was people couldn't go fast enough to get their kids immunized. There was a kind of mass immunization event at Crescent Elk. And that vaccine actually initially was a little bit hard to come by. And so what they did within days of the diagnosis is they immunized all the ER physicians. They only had 10 shots. And then they came over and immunized us. And it was people seriously fighting to update their immunization because pertussis, aka whooping cough, is also called the 100-day cough. And if you ever see, it's annoying for an adult, but not necessarily dangerous. But if you see an infant with it, it's potentially life-threatening.
I've never seen an infant.
It's awful.
I've taken care of several babies that had the croup and the steam in the shower, and you hold them, and
Right.
that in and of itself, you just sit there and you cry because there's nothing that
Right.
you can do.
Right.
But to the two children I have ever seen with whooping cough, they were I think one was 3 and the other one was close to 5. But the blackened eyes, the pale in the skin, the weight, they've lost weight,
Right.
and it doesn't stop, and
Right.
it is gut wrenching, and there was nothing that we could do. It was just take turns and try to hold this baby and try to help them breathe. It was the most horrendous experience of my life, and I've taken care of an infant who passed away with AIDS, and I make sure that when there's a new baby born that I have my whooping cough.
Right. Yeah.
In my family,
That brings
I'm
up
in line.
another good point. We all stand around an infant to protect it. So children can't start to get immunization for whooping cough until they're 2 months old, and they can't get full immunization actually till they're 5. But it's so the family should stand around that infant and all be immunized and kind of create a wall to keep that baby safe.
Yeah.
So that's what you said you're doing. That's important.
Yeah, I just don't think we don't see it as often because of immunizations the way that people saw it 50 years ago. And now people just don't understand how horrendous that is.
Right. And so in talking to Kalani Baker, who was my PA colleague at the time at Redwood Urgent Care, or not Redwood Urgent Care, but the Sutter Urgent Care, she said she heard that baby cough when she was outside the room, and it was like a dagger in her heart.
Oh my gosh.
And she got that baby to care, and and the community responded in the best way possible. They stepped up and they got the kids taken care of. And although it kind of went through town and a number of people were sick, it could have been much worse than it ended up being.
Yeah. Oh,
So-
I'm sorry you had to witness that.
So extended schedules are not as protective. Keep that in mind. And what if a child has cold symptoms? So parents will oftentimes bring kids in for well-child checks, and they said, oh, his nose is runny, so he's too sick to have immunizations. That's not really true.
That's not true.
That's not true.
So the whole my kids, that's not a thing to cancel your appointment with your vaccination is because you think your kid's got a cold?
Right. So the risk to that kid's health is more from a future threat than it is to just get the shot when they have a little bit of runny nose. If you take care of kids, they cough and they have runny noses constantly. And we pretty much get them all healthy about this time of year, and then school's back in session and we're off and running again.
So I'm going to pause you here on this one. So you were talking about your concerns as a mother that when you went to your provider, and then full transparency here, I don't have any children of my own.
Mm-hmm.
If I came to you as a mother and you were my provider, my child's provider, and I said my child has a cold and I'm not comfortable with him being vaccinated today, what would be your response to a mom, as a mom
My
and a provider?
response would be that if they don't have a fever, they're probably safe to get immunized. But if you want to wait, let's have a plan that's more real than, come in a week for a nurse visit. Let's set you up with that appointment for a nurse visit and understand that it's only going to be a week, and then the immunization happens. Make a solid plan. And this is important in general. If somebody chooses not to have their children immunized, then they have to have a plan about what they're going to do when disease comes through town.
Oh.
And I don't. And if I say that to a parent who's wants to not immunize their child, there's this look of panic in their eyes, and they're unable to answer what the plan might be. So, if I was that mom, I would be thinking, how would I know what's going through town? Would I stay in touch with the public health department? Would I stay in touch with my my child's teacher or daycare provider so they understand that my child has that risk? If measles comes to town, sometimes kids have to be sequestered for 3 weeks. How is that going to work with my job? I'd be thinking about that. And so when something comes up, because it'll come up fast, then I'll be able to kind of take steps immediately to protect my unimmunized child.
Well, that makes sense.
Yeah, and there's no plan.
So they don't. So they miss that end of the being responsible. I'm going to make this choice for my child, so I now
Right.
need to now make.
So there's
these choices.
consequences.
Okay.
And there's consequential choices that need to be made. And some you could argue, like with measles in Texas, breaking out, that people were giving their kids extra vitamin A supplements and stuff. None of that really works and has a definite danger, because over supplementing with vitamin A has its own problems.
Okay. So that is one of those vitamins that is you can overdose on.
So, how's your boss gonna react to you saying I have to like not go to work for a month to make sure my children are safe? Some people,
My boss is not going to react well to that, and I work with the medical professional peoples.
right?
I mean, they're going to understand, but that's not going to be a happy thing.
I don't know. Could you work from home? Could you,
No, I would have to go for a month without a paycheck.
yeah, or maybe even give up your job. I think
Yeah.
it's fair to say that there's some jobs in our community where people would actually lose their job.
Absolutely.
Yeah,
Most of the people in the community would lose their job. Safeway's not going to hold your job for a month.
no way. So,
I'm
And-
not picking on just Safeway. I apologize. That's where I shop. I'm sure they're lovely people.
So the next thought I had is in parenting a child and thinking about immunizations, especially for the olders, for the teens. So HPV and meningitis shots, I see those as an early adulting step.
Oh, an adulting step.
It's an adulting step. And I'm in the exam room, make a big deal about why it's an adulting step. And I think as a mom, when I was raising teenagers, we spent a lot of time focusing on making good adult decisions. And this is, did you consider this? And have you thought about safety and stuff like that? So like the basic set of shots for younger children, these are different. So you raise children to become functional adults, right? And so when you get them ready for adult life events like sexual activity or smoking/vaping or moving on to different group living situations, say dorms or maybe, in the armed services, you want them protected. So flu and COVID immunization might be required for certain jobs or for travel. And if you're raising them to be functional parts of society with hopes and dreams of their own, you want to send them off as safe as possible. And so that's usually the immunizations that I look at for the teens. And very few people in Del Norte County get their kids immunized for HPV. It's both for males and females. But I have seen the worst HPV-related disease in Del Norte County in young men who chew tobacco.
Oh, wow.
So if you're trying
I did not know it was for both, to be honest with you.
it's horrible. And if you are raising a kid to be a healthy, functioning member of society, this is part of what you send them off with.
That would make absolute perfect sense.
Yeah, total.
So does this also set them up when you bring them in for the early adulting and learning to be adulting to
Right.
have better health care as they age, so that they maintain their annual visits and
Right.
take care of their normal things and
Right.
for better health overall long term?
Right. And they, that's part of actually what Teen Clinic is adulting. And so they have to come in and they have to fill out a form and they have to have some kind of knowledge, let's say, about insurance sources. They get definitely supported through the process, but it just blows them away that there's formage involved and things like that.
But it's early adulting. You're learning to do
Right.
that process
You're
and to
learning
be responsible for yourself.
how to interface with the medical receptionists, and you're learning that they're not terrible, scary people.
Yeah.
And you know what questions, you have an expectation of, in general, what they're going to ask you. And, you kind of navigate your way through it a couple of times, but they're super helpful and you don't have to be afraid of them.
So that takes away the fear. So again, as your children grow and they become independent and autonomous of their parents,
Right.
they can take care of these things for themselves
Right.
and maintain their health throughout their entirety of their life.
Yeah, as opposed to an 18-year-old who's always been taken care of from local pediatricians, has maybe their first semester of college or their first semester, of mechanic school in Arizona, and they get mono and they don't know what to do, and they're in Arizona and their mom is up here, and they're you have to give them these tools. So it's bigger than immunization too.
Okay.
So, and then the other thing I did right as a mom was I reached out to my child's provider, and I saw her as the best person to get credible information from. And even though, initially she just gave me the standard reply, her actual, what she probably thought was just a, secondhand comment is what made it for me. It's what resonated with me the most. We, as healthcare providers, share the desire to help you raise healthy, functional adults.
Oh, wow.
Yeah, we are not interested in hurting your child. We have the data on our side, and there's plenty of studies if you want the specifics on that. But talk to your healthcare provider. It doesn't mean that you necessarily are getting railroaded or that your chart's going to get marked or that you get thrown out of the practice. It means it's an opening of the conversation, and that can happen at your pace. But be consistent about it and keep coming back if you have questions about this or questions about that. And I know there's excellent, although limited, pediatric care here by pediatricians, but also by regular family practice physicians and PAs and NPs in this county. And we're quite lucky that we're all pulling together on this one. So this is the whole reason for this talk today, is that there's a Get Ready for School vaccination clinic through the Public Health Department coming up.
Ooh, there is, isn't there?
There is. Tuesday, August 19th, coming up. So it's Tuesday, August 19th, 9 to 11:30 a.m. and 1:30 to 3:30 p.m. at 400 L Street, which I think is the Public Health Department office.
Okay.
And then for an appointment, apparently it's by appointment, but if it was me, I'd show up anyway, is 707-464-0861. So that's who you can call for more information and to set up an appointment. They want you to bring immunization records and a parent or guardian ID or a letter of consent from the parent. So if there's court-approved paperwork that's applicable, bring that in. And you might say, well, I don't have any immunization records. I'm not going to do that. It takes them a really short period of time to go into a California database and get immunization records for your child. So don't get hung up on any of this.
So you can still go if you don't have the paperwork.
Yeah, I think the deal breaker is if you're like an auntie who's bringing in a niece or a nephew, you better have a signed paper saying that the parents are okay with that. And the child must be under 19 years old, either be uninsured or on partnership or native. So that access is coming up in our community, and I wouldn't get hung up on all of these, I guess, requirements to get your child seen. I don't think it would be a big deal if you showed up with the proper consent letter signed and said, this is my niece and she's kind of behind. What can you guys do for her now? I want her to be healthy in school.
Gotcha.
So I think that's an exciting opportunity, and I hope somebody out there is listening and thinking that this is something they could do for the child in their life. Immunizations are so important, and I'm a little worried in the community. All the healthcare providers are worried about measles. I've been in this business about 40 years. I've never seen it, so I'm a little worried.
You've never seen a case of the measles?
Never. You know why?
Immunizations?
Yes.
I listened, Lynn. I listened.
Yeah. But I have seen whooping cough in children. I have seen my share of influenza and COVID. And I think immunizations are such a great tool. As a mom, I'm really thankful that my young adult children, actually they're getting closer to middle age now, are really interested in making sure that they get immunizations at the right time and, for the right disease risk that they have, or for the goal that they have, maybe to travel or something, which immunizations do I need for that, Mom? And that we listen to their physician, Dr. Julianimus, that was you, at Norte County Clinic. Yeah. And, that our family learned from that horrible 5 days where everybody had influenza and the mom was the only one still standing. So,
typical mom.
Yeah. Well, we were lucky. That time nobody got so sick they had to go to the hospital. I mean, children die of influenza.
Yeah.
It's not uncommon.
It's very sad.
Yeah. So,
is there anything else you'd like us to know?
Maybe say that phone number again.
All right, I gotcha.
You got it.
So thank you for participating in this episode of Health Matters with PA Lynn. If you would like to catch a replay of this episode, you can always go to KFUG's YouTube channel, hit the playlist, scroll through, hit the playlist, and listen to any of the past 7 years of episodes of Health Matters with Lynn. And this Tuesday, August 19th, from 9 to 11:30 and 1:30 to 3:30 at 700 L Street, Crescent City Clinic. You're going to call 707-464-0861. That's 707-464-0861. Don't forget to bring your immunization records or parent or guardian ID with a letter of consent or court-approved paperwork if applicable. And the children being immunized must be under the age of 19, on Medi-Cal, uninsured, or be native.
Right. That's 400 L Street, 464-0861. If you don't have an appointment, but you feel like the need, I bet if you show up, they can make arrangements to help you. If you don't have your immunization records, don't worry about it. They can access it online.
Great. Thanks, Lynn.
Mm-hmm.